The following is a paid presentation for TMJ Therapy, brought to you by Dr. Brock Rondeau.
You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. We're very pleased to have in studio an internationally recognized lecturer, author, and educator in the treatment and cure of sleep apnea and TMJ. So if you snore, toss and turn at night, are always fatigued or tired, have chronic neck or shoulder pain, have a child who's undersized, still wets the bed, has difficulty focusing, or has even been diagnosed with ADD, then you don't want to miss what our guest has to say. So stick around. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. Our guest today is Dr. Brock Rondeau. Dr. Rondeau is a member of the American Academy of Dental Sleep Medicine, a diplomat of the International Board of Orthodontics, and a diplomat of the American Academy of Craniofacial Pain, a small and select group of dental professionals specializing in the treatment and cure of sleep apnea and TMJ. Dr. Rondeau's practice in London, Ontario, is recognized by patients and peers alike as a cutting-edge facility in the care and cure of these disorders. Dr. Rondeau, welcome to the show.
Thanks, Mike. It's nice to be here. Thanks for inviting me.
All right, I brought you on the show today to talk about TMJ, which is the dysfunction of the jaw joint, what it causes, the problems that are connected with it, what it really is, and who it affects. But before we get into that, take just a moment and tell me how you came to be involved in TMJ. And I know you teach all over the country or the world other dentists how to treat this. So what brought you to that?
Well, I started treating children. I started using functional appliances on children to bring their jaws forward. And I found that the kids had headaches and ringing in the ears before I started. And after I used these functional appliances for 7 months, the headaches and the ring in the ears and the other symptoms went away. So the mothers who had a similar hereditary problem.
Is it a hereditary problem to some degree?
It is. It is.
So if you're a mom with headaches and jaw joint problems, probably a good thing to have your kids checked?
It's very important.
Okay, so you sorry to cut you off, but you start talking to parents.
So I talked to parents. The mother would say to me, you know, that appliance you put in for my daughter really helped her jaw problem. She doesn't have headaches anymore. And she said, would you help me? And I said, well, I haven't had a lot of training in TMJ because in dental school we don't get a lot of training, but I'd be willing to try some of these appliances with you. And lo and behold, I put those appliances in, and if the problem is that the lower jaw is back too far, and you use these appliances, they work, and they do get rid of the headaches. So if there's a structural problem with the disc is out of position, and the patient's clicking when they open and close, and the jaw's back too far, then bringing the jaw forward will help the TMJ problem.
Okay, we're going to look at a little clip here in just a second, but you talk about a disc, and well, TMJ, the jaw joint, your mandible, you open and close. It's one of the only joints, if it's my understanding, that actually slides while you're working. There's a little cartilage disc that it slides on.
Yes.
And so you're saying if that disc gets pushed forward or pushed back,
usually forward,
it causes problems.
Big problems.
All right, before we look at the clip, let's take a look at the disc. What is this we're looking at?
Looking at a normal temporomandibular joint, normal jaw joint.
All right.
And you can see that the top of the jawbone, which is called the condyle, is right in the middle of the socket.
Okay.
And the disc is in the normal position.
All right.
And there's lots of room between the back of the jawbone and the ear.
Because between that jawbone and ear is where you told me blood vessels run.
And nerves.
Nerves. And so if that jaw joint gets out of line, it has a tendency to want to push back on that?
It compresses those nerves and blood vessels and causes all the headaches and all the ear problems. The ear is very close to that, and that's how the patient get ring in their ears. And we talked to one of your people here in the studio, and she's got ring in the ears.
So she hates quiet because then she hears the ringing in her ears.
And she's also got a deep overbite. Adults with deep overbites, when the top teeth come down over the bottom teeth like that, that's a very common cause of jaw problems.
But she had orthodontics done.
Yes.
Won't that correct the situation?
No, orthodontics only gives you straight teeth. So you need to pay attention to where the jaw ends up in the socket. That's the key. Now, some clinicians pay more attention to the jaw joint than others. Some clinicians are just concerned with giving straight teeth because that's all they were trained to do. Some clinicians have taken extra courses in TMJ like I have.
Not to cut you off, but you talk about training. Now, I know you belong to, in fact, you're very high up in a lot of organizations, or a few, that specialize just in these issues, and those are the American Academy of Craniofacial Pain?
That's correct. And this year I achieved my diplomat status, which is the highest status you can get. And I had to study a long time and write a very difficult exam and show that I've treated 100 cases successfully in order to get that diplomat status.
Because any dentist can treat TMJ.
Correct.
By definition. You're a dentist, you qualify to treat it.
Right.
But just because you qualify to treat it doesn't mean you are qualified to fix it, right?
Some dentists don't want to treat it. Some dentists are very happy, do a great job doing veneers and fillings and root canals, and they do a great job. And so they take extra training in those areas. I just decided to take extra training in these areas. So I have 50% of my practices now treating patients with temporomandibular joint disorders, with jaw joint problems.
And you do teach, like I said, and lecture all over the country on this subject.
About 100 days a year.
Thousands of dentists.
Thousands of dentists.
Come to you to learn about it.
Yeah, I get a kick out of that. I want dentists to learn how to do it correctly. I'd like to change dentistry. I'd like to see the dental profession change.
Well, I want to tell you that one of the reasons I really wanted to talk to you in particular is, I interview dentists, I interview doctors all the time, and every now and then you get to talk to somebody, and I spoke to you for a little while, and you find out their passion, so to speak. And I was amazed at you. You seemed to light up when we talked about helping kids.
Oh, yeah.
You were very into helping adults and bringing them out of pain, and it was something you enjoyed and you were very good at. But when we talked about the kids, a whole different person seemed to come out. You got very excited and very. Is it something that really motivates you to I mean, is this something that is personal satisfaction is as good as the financial?
Absolutely, because I mean, with adults who have the problem, you're treating them. But with kids with the problems, you're preventing it from happening. So you're taking a situation where the jaw's back too far and putting in an appliance for 9 months, and you're bringing the jaw forward, and you're getting them. They'll never have that problem. So I love prevention, but I like helping adults also, because I had a female in my chair about a month ago, and she was complaining she had everything wrong. She had headaches, she had snoring and sleep apnea,
neck pain,
wasn't sleeping well, fatigued all day, fatigue. And of course, I always ask personal problems. I always ask personal problems. I said, may I ask you if you're sleeping in the same bed with your husband? And she said, no, I'm not. So I know it's a real serious problem. If she's snoring that loud, then her husband will be in a separate room. So I put an appliance in to bring her jaw forward. 1 month later, she jumps out of the chair, runs up to me and gives me a big hug. So that was nice too. So I do like having adults.
Wait, no. The problems were gone?
Problems are gone.
1 month.
1 month, okay? Now she's back in the same bed with her husband. She's got no more headaches, no more daytime fatigue, because sleep apnea, it really tires you out during the day. So you're tired all the time. You're tired at work. Sometimes you fall asleep at work. You fall asleep at the wheel when you're driving home. You fall asleep watching TV. You're just not the same person. So she has lots of energy now, and she's really happy because she likes her husband. She wants to spend some time with him.
All right, let's look at these pictures real quick so we can get an idea of what we're talking about, because I have to tell you, it would never have dawned on me that all this stuff can come from one little bitty joint.
Right.
You know, we have a headache, we go see the doctor and he gives us medicine.
Right.
We have a neck ache, we go to see the doctor, he gives us a muscle relaxant. We have this, we go, they give us this. You tell me you cure the cause, which eliminates the need for the medication. All right, so this is a normal TMJ. Let's get that picture back up again. That's a normal TMJ. Let's take a look at the next picture. Okay, now what's going on here?
Now what's happened is the patient's jaw's gone back too far. Now, frequently that happens when you have a deep overbite, or it happens when you naturally have a jaw that's recessive. The patient's front teeth protrude and the back teeth are back here and the jaw's back. So this now has the disc, you can see, is out of position.
So it's forcing the jawbone, the lower jawbone now is much more to the right or pressed back against the ear canal.
Yeah.
And then it presses on those nerves and the blood vessels in there, and that's what causes the problem?
That's right, and it's the bite that causes that. The way the teeth bite together determines where the jaw goes. If the teeth bite together forward in the right position, or they don't have a deep overbite, then the jaw's in the correct position. But if the jaw's in the wrong position, that's a real structural problem. You're compressing the nerves and blood vessels at the back of the joint and causing all kinds of problems.
And so the click we hear when you open your jaw and you hear it goes
Right.
pop. What we're hearing is that disc is now, like in this picture, gone to the forward of the bone.
Right.
So instead of the bones sliding on it smoothly when you open it, the bone's going clunk up on it and pop back off of it.
That's right.
So if you have popping of the jaw, whether you've noticed any other symptoms at all yet, it's probably a good idea to go check.
Usually, patients who click will have some symptoms. So they have to, but a lot of patients think that their headaches are caused by stress.
Do you find that most people, I do it, we have a tendency to make excuses for why we feel the way we do? I mean, if I put my hand on a hot stove, I yank it off, I run to get something to fix it up.
That's an acute problem.
Right, but my neck starts hurting. I think, well, I'm stressed out, I slept wrong.
Right.
Do you find that most people don't even realize what they can fix by getting proper treatment?
Absolutely. People have ring in the ears, and they just have to put up with it. People have headaches, and they just learn to live with it. And when they go to some professionals, they tell them, we don't know what's wrong, so I guess you're going to have to live with it. But I would recommend that if they have headaches or ring in the ears or dizziness or fainting or any of these problems, stuffiness in the ears, neck pain, shoulder pain, that they go see a dentist.
Lower back pain?
Lower back pain. Go see a dentist who likes to treat TMD, because not all dentists do.
Right.
Go find a dentist that has taken some courses in TMD and likes to treat it, because there are lots of dentists around that do treat it, and they just have to find one, and they can check with the American Academy of Craniofacial Pain website, and they'll find a dentist in their area that can help.
All right, when we come back, we're going to talk about treatments for it and how simple it is actually to take care of once it's been diagnosed. We're in studio with Dr. Rondeau. We're discussing TMJ. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Rondeau talking about TMJ. All right, before we went to the break, we were talking about what it is, what causes it, looked at some photos. I want to take a real quick look at a video you brought that shows what goes on with TMJ, and then I want to talk to you about treatments. So first, let's take a look at the video. All right, this is a video of a TMJ joint,
right,
which is just your jaw joint. The lower red line is your mandible that goes down. The upper red line is just the plane of your upper jaw.
Yep.
All right, so is that, what's in the yellow? Is that a fat pad?
The yellow is the nerves and blood vessels behind the jaw, and the jaw has to be more downward and forward. The farther back the jaw goes, the more those nerves and blood vessels are compressed.
Kind of like the picture, where the disc had come off and pushed the jawbone back.
Yeah, the more they're compressed, patients in a lot of pain, and if you don't fix that, you'll probably never get rid of a patient's headaches. It'll also get rid of migraines. A lot of patients think they have migraines, and all the time it's a tension headache due to the jaw being in the wrong position. What happens when the jaw is in the wrong position, the muscles that support the jaw go into spasm, and when they go into spasm, that's what causes the tension, and that's what causes the headaches. It's the spastic muscles seizing up that cause the headaches. So we have to fix that problem. We've got to get the jaw forward.
Well, I don't know that you would know this. I read something the other day that said that most migraine medicine doesn't, I don't want to say work, but has a very little or no effect on migraines. I have a couple friends that are migraine sufferers who have the medicine, but I know when they have a migraine because they don't answer the phone, their house is dark, they're locked in a room somewhere, no light. And I said, well, don't you take your medicine? They go, it doesn't work. Obviously, for some people, it probably works really well. But is the reason maybe it doesn't work is because we're not treating the cause? We're just masking the symptom?
That's right. And maybe the migraine is not a true migraine. Maybe the headache that they're having is a TMJ headache, a jaw joint problem, rather than a migraine. So therefore, migraine medication doesn't work for TMD problems. All
right, well, let's use the video real quick and see how the jaw joint can collapse on that. Now, this is a normal jaw joint. Just slides out over the disc. Now, is the orange is the disc?
The orange is the disc.
Okay.
And that has to be between the two bones at all times.
Okay.
And there should be no noise, and no clicking, and no discomfort.
It's just a nice, smooth slide.
Right.
All right, and then what starts to happen?
Well, then the jaw goes back too far. When the jaw goes back too far, it not only compresses the nerves and blood vessels and causes pain, but the disc slips in front.
Okay. And then you start to get the little pop.
When the disc slips in front, and then when the patient goes to open, to talk, or to chew, the jawbone slips over the disc, and you hear that pop.
Right there.
Right there.
And then what happens if you said it's it's a degenerative disease, it just keeps getting worse?
Yes, there's 5 stages
And what happens
of disc displacement, and eventually, when it goes up too high, the patient has a real deep overbite, it'll perforate the ligament behind the disc, and then the jawbone hits the skull bone, and you get terrible noises called crepitus, or cracking noises, very loud noises when the patient opens and closes, because the protective disc is gone, and now the jawbone starts to wear down. The jawbone, actually, you can see, instead of being nice and round like it is there, it starts to flatten off, and the patients really, that's when they get into advanced degenerative osteoarthritis, that's very, very painful and very, very serious. So you want to fix it when it's early. And that's why I try to get my patients to come in when they're getting their headaches and they're clicking and they're having inability to open their mouth and they have these beginning signs. They should get in and get that fixed. All we have to do is reposition the jaw. I can reposition the jaw with something as simple as this. Little splint that goes over the lower teeth.
So no headgear, no...
No, just a little splint goes over the lower teeth. And we move the jaw forward and have the patient bite into this, and they have to wear that all day long.
Can you see it? Is it a,
No, you can't see it.
So they go about their regular day, it's in there.
I'm wearing one now. Have you seen it?
You're wearing one right now?
I'm wearing right now, right there.
Well, I can see it now. Yeah, absolutely. And that's it.
I can talk fine. I eat fine. But my jaw was off just slightly.
Are you
So I'm
saying you
wearing this.
practice what you preach?
I try to practice what I preach.
All right,
absolutely.
let me ask you, people come into you. Obviously, I deal with all kinds of doctors. I deal with a lot of quote-unquote pain management doctors. And I've come to understand that, obviously in their heart they're doing what they feel is best. They're wonderful human beings. But basically what they're doing is deadening the nerves so you don't feel the pain. So the problem's still there, but you just don't feel it anymore. You're telling me with this, not only you eliminate the problem, but there's no medication, no drugs?
That's right. My patients don't need medication or drugs. Once I get the jaw in the right position and solve the problem.
Have you had patients that have been on pain management or have had problems that have come in and seen you and been able to get off of them?
Some of them come in with 10 different drugs they're on. And my objective was in 4 months to get them off all medication. And usually we're very successful, except for a patient that's had surgery. I mean, sometimes the oral surgeon will go in and cut the jaw right off. They cut the jawbone right off. Well, those are pretty tough cases to treat. And
now, I wasn't going to bring that up, but you mentioned it, and I know, and I had the occasion to speak to a gentleman who had done 800 surgeries where they basically, I don't know if they cut it all off or they cut it back, the condyle, and I just talked to him and I said, how does that work? And he said that, 10 to 15% of the people, it works great. That's what he said to me. And I said, well, what about the other 85? And he said, well, it doesn't always work the way we wanted it to. But once you get surgery, once somebody physically goes into your body and cuts something out, you can never change that.
It's very difficult to treat. I have had to treat some of those patients, and I have helped some of them, but it's very difficult.
With an oral appliance, before I have surgery,
right?
If I put that in and it doesn't work for me, I can just take it out.
That's right. So
it hasn't changed anything.
That's right.
If you're going to go get checked by somebody for TMJ, there are a few things you should make sure they have. And one seems to be the proper equipment.
I just want the dentist to take x-rays of the jaw. He can either have the equipment in his office, or she can have the equipment in the office, or they can have access to x-ray machines. But the dentist that doesn't take x-rays of the jaw joint, I don't think can really say that he thoroughly examined the jaw joint.
And then you also have a machine, don't you, that checks for vibrations in the joint?
That's right, called the joint vibration analysis, and that checks to see how serious that problem is. How serious is that disc out of position? Are we going towards clicking, to jaw locking, to crepitus?
Because you should really have no vibration, noise.
Vibrations.
The vibration is the movement's not smooth in your jaw joint.
That's right.
Okay, so back to why do you think most people don't go get checked? Why do they continue to go down the path of either pain management or suffering through it? I have friends that take 18 aspirins a day.
That happens a lot. I think our medical schools and dental schools could do a little better job of educating us in terms of TMJ. I think we're so busy learning how to fix teeth and fix gums that part has been neglected in some of the dental schools. Some of the dental schools are getting a little better at it now, some of the medical schools, but I just find that the patients that come to me, it's just like the lights go on. We spend about an hour with each new patient explaining what's going on, showing them some of these videos, taking x-ray of their joint, doing a history, do the joint vibration analysis, and they're amazed. They said, "You mean that this actually can be fixed?" I had no idea that these pain problems, these neck problems, could be coming from the jaw joint. Nobody ever mentioned it before. And so they're amazed, and some people start to cry. They say, "Do you mean to say that I've been everywhere? I've been to acupuncturists and chiropractors and
Neurosurgeons.
and neurologists, and they are all excellent at helping the patient if that's the problem." For instance, if you have a neck problem and it's not coming from the jaw, because some problems in the neck come from the jaw, the chiropractor is someone you definitely want to see.
Right.
And neurologists, if you've got a tumor, you definitely want to see a neurologist, because if the pain is coming from a tumor, you definitely want to get that seen too.
But let's say I had ringing in my ears, and I went to an ENT.
Right.
And he looked in there. Obviously, if I have an infection, he's going to give me antibiotics.
Right.
He looks in there, I don't have an infection. I just have ringing in my ears. Now what?
Well, some ENTs understand that could be TMJ and will refer to a dentist that does TMJ.
So you personally work hand in hand with other doctors in your market?
Absolutely. You have to. You have to. I mean, other healthcare professionals can help with this too. But if you got a structural problem, you need a dentist to fix it. If you got a dislocated jaw, you come to a dentist.
Another quick break. When we come back, I have a few more questions, and then I want to get into the results that you can achieve and how long do they last. We're in studio with Dr. Rondeau discussing TMJ. We'll be right back.
Mr. and Mrs. Jones, Sally's having some behavioral problems.
I guess that reward system isn't working.
Well, the timeouts weren't either.
You know, parents do find that timeouts aren't...
See?
Well, you're just too lenient.
Well, you're too strict.
No, you are.
Oh, you are.
No, you are.
No, you are.
When adults don't have the answers, they can feel as frustrated as kids. ConnectForKids.org has thousands of resources for helping kids in your community. ConnectForKids.org, guidance for grown-ups.
Welcome back. We're in studio with Dr. Rondeau discussing TMJ. How much time in continuing education do you think you put in to get to this point learning?
Oh, thousands and thousands of hours. Thousands of hours. But I like it. I enjoy it. The more I learn, the more I feel I can help more people. The more I learn, the more I feel I can help more dentists learn to help more people. So I like this.
Do you find that because you are involved with the other medical professionals in the community you're in, do you find that their awareness of what you're able to do as a whole becomes better? I mean, as time goes on, do you see more and more people referring you patients?
Yes. Yes, we're getting very busy.
So I'm at home, I'm watching, I'm listening, what would I look for? What would be signs or symptoms that I might have TMJ?
Well, first of all, when you open and close, it should be noiseless. You open and close, there should be no clicking, no noise. Secondly, you should be able to open. You should be able to get 3 fingers in.
Into your mouth.
In your mouth, like a Big Mac.
Okay.
You got to be a Big Mac supporter there.
And if you can't open your mouth that far, it's a pretty good sign?
Then that's another sign that you have a problem. Okay, so those are signs. Now the symptoms we've talked about, the dizziness, the headaches, the neck aches, the earaches, the ring in the ears, all of those things are symptoms.
What about, and I know this sounds, what about if I chew gum or I do it and my jaw gets really sore?
Then that's a sign that you've probably got a problem.
It should.
Because TMJ patients can't chew gum. They can't eat hard foods. That's a good point. They can't eat hard foods. Any chewy foods, hard foods, steak, anything like that, they can't eat it. So they have to go to soft foods.
So if they don't eat the hard foods, and again, if you're not chewing meat, if you're not eating hard, if you're eating nothing but soft, squishy food, I would have to think that physically your body's probably not getting the nourishment it really needs.
I think that's probably true.
Which leads to other ailments.
Yeah.
So what other signs or symptoms?
Those are the main ones. And apart from the pain, the headaches are number one. I mean, those and a lot of people think that it's other things, stress.
What about like carpal tunnel? Is it possible?
Well, it's possible because a TMD problem can cause pain going down the arm and a tingling feeling in the fingers. And that can be confused with carpal tunnel syndrome. So the thing to do is get when you irritate the nervous system, all kinds of things go on. I had patients who had problems with their stomach, and they went to they went to all these specialists, and they couldn't figure out what was wrong. I put their jaw in the right position, their stomach problems went away. Because the system was so irritated the nervous system was so irritated by the jaw being in the wrong position that it just affects the whole body.
Okay, I interviewed somebody and I talked to them, a patient, it was of someone else's, and she said to me, point blank, she said, somebody told me about this, I almost didn't go, I made an appointment, I wasn't going to go, I've seen 23 doctors, why another one? Right? Nobody can help me. And she went and saw a dentist that specializes in TMJ, and he happened to be, which is how I got to you, one of your students. And I talked to her, and she said, I would never believe this. It's a miracle. It's only I can say it's a miracle. You know, for 7 years of my life, I've just been in miserable pain. I've been horrible. Do you think, would you tell people if you're in pain, if it's been consistent, you can't get rid of it, to at least go get checked?
At least go get checked, get the diagnosis.
I go to a doctor, I go to a neurologist, I go to an ENT, I go to 3 gastrointestinal guys. Nobody finds anything wrong. I start to think it's
you.
It's in my head.
In your head, yeah.
I'm going to live with it the rest of my life.
Right.
Obviously, at some point, I'm going to give up hope. I don't care what comes by, I'm not going to try anything. There are all those people that will continue to try.
Sure.
Do you think that there are a number of people out there that suffer every day and don't need to?
You know, in my opinion, 90% of the headaches are jaw related. Now, it's not all jaw position. It could also be a number of patients clench and grind at night. If you're clenching and grinding every night, you're supposed to relax when you go to sleep. You're not supposed to do that. Then the muscles tense up and they wake up with morning headaches.
What are signs you clench? Because somebody said to me, it's easy to know you clench if somebody's watching you, but what if you live by yourself? What's a good sign? How would I know that I clench at night? My teeth wear down?
Your teeth wear down.
My jaw sore in the morning?
Jaw sore in the morning and you wake up with headaches.
All right.
A lot of people clench, Mike. A lot of people. And so we knock out the clenching problem by putting a special night appliance in. It's called an anterior deprogrammer. It makes it so you only hit on your front teeth, you can't hit on your back teeth, so you can't clench. So a lot of my patients have clenching problems, so they have a night appliance to wear at night to prevent the clenching, and the appliance during the day to move the jaw forward, to decompress the joint, to take the pressure off the nerves and blood vessels, and they do well.
The people that have been in pain for years.
Yes, I remember one time, I was just thinking this, that I had a patient came in, I eventually put a splint in for her, and I phoned her the next day and asked her how she was doing. The 401 is a main highway that goes between Toronto and Detroit. And she said to me, 15 minutes on the 401 got rid of 15 years of pain.
After she left your office?
Took 15 minutes for that to work.
Now see, I'm
not always that good. But
well, but you have not alluded to anything over, I've heard a month.
Yeah.
I've heard within 4 months, and now 15 minutes. Is it really, if it's going to work, is it really that quick?
Oh, yeah, sometimes it's that quick.
All right, I want to thank you for coming in. You've been
it's
very
been a pleasure,
informative.
Mike. Yeah,
thank you.
It's good.
You've been watching Medical News Network. I'm Mike Wittgenstein. For future information on this subject or any other, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.
The proceeding was a paid presentation for TMJ Therapy, brought to you by Dr. Brock Rondeau.